today, remember the pharynx and esophagus are two very important parts of our anatomy, because we're going to chew our food, and mastication is in the oral cavity, and then the tongue is going to push the food back as a bolus into the pharynx. The pharyngeal constrictors are going to they're going to push it down into the esophagus, which is guarded by a muscle called the cricopharyngeus, which belongs to the pharynx as well as to the esophagus, because it's the upper esophageal sphincter. That cricopharyngeus is constantly being contracted, right? And only sort of relaxes when the food comes to it. Because if that was not so, then as you breathe, you'll be swallowing air all the time. So, Dr. Shetty went over the mastication and swallowing with you, so I don't need to go over that again. But I'm just going to show you the pharynx today. All right, so we can go on to the specimen of yes. And if you have any questions, probably periodically, right? You can ask some questions. And definitely at the end, I'll have some time with you. All right.
So what I'm going to do is go over your shoulder. What you're saying.
Yeah.
I need to see the students.
Yeah, that's fine. That's great. That's great. All right. So just remember that the pharynx is a fibromuscular tube, right? Okay, and it's 12 to 15 centimeters long. It starts up here at the base of the skull, which I'm going to show you a little while, right? Okay, and it ends at the level of the C6, right? This is the lamina of C6 you see in here. This is the C6 cartilage, right? Okay, right. Sorry, the cricoid cartilage, which is at C6 level, which is at the cervical vertebral level 6, right? Okay, right. It's largely deficient anteriorly, and I want to go back to when I tell you it's a fibromuscular tube, because it has a significant fibrous component, which is called the pharyngo-basilar fascia, and I'm going to be going over that in a little detail with you. Because when we get down to the esophagus, then I'll tell you it's a muscular tube. The stomach is a muscular tube. The intestine, colon, the small bowel, colon, rectum, they're all muscular tubes. But the pharynx is fibromuscular, right? It has this significant component called the pharyngo-basilar fascia, which is insinuated between the mucosa of the pharynx and the muscularis, right? So that's the second layer. So the layer line in the inside of the pharynx is stratified squamous epithelium, non-keratinized, except right up here in the upper part of the nasopharynx, where it's respiratory type epithelium, and that one is pseudostratified, columnar, ciliated, right? But all the rest of it is stratified squamous, non-keratinized, right? Then it has the pharyngo-basilar fascia. Then we have the muscularis. The muscularis is mainly the three constrictors. You all came to my lecture, so this is nothing new for you, right? The superior pharyngeal constrictor, the middle pharyngeal constrictor, and the inferior pharyngeal constrictor, all right? And then outside now, unlike the rest of the bowel, it doesn't have a serosa. Well, the esophagus is like that also. But it has this lining on the outside here, which we call adventitia. What you see in here, that's adventitia, right? Now, because that fibrous tissue or adventitia extends from the buccinator muscle. Again, you haven't done the oral cavity, but I'll show you the buccinator, right? Okay. And it goes on to the constrictors. This is called the buccopharyngeal fascia, as an external lining, right here. And here we can see, this is the prevertebral fascia here in front of the vertebra, right? And this is a potential space called a retropharyngeal space. And sometimes you get pus in there, right? Okay, right? So let's say it's largely deficient anteriorly. So here we can see, so this, what we're seeing right here, this is the pharynx, right? Okay, right? It's largely deficient anteriorly, right? Okay, where superiorly it communicates with the nasal cavity here, right? Via what we call the choanae, Choanae, or the posterior nares. Right? So this is the nasal cavity here, and here we enter the nasopharynx. This is the hard palate here, right? We don't have much of it here because it's cut a little bit to the side. And this is the soft palate we see in here. And we can see the palatine aponeurosis right in there, right, which is attached to the hard palate, which is right here. Right, okay? And then here now is going to anyone you want to call it, right? Okay, right, which is going to cover the palatoglossal muscle, which should have been discussed with you in the oral cavity, because that's not in the pharynx, right? Okay, so this is the palatoglossal arch. This is the palatopharyngeal arch you see in here. We're going to go over all that, right? Okay, this is the posterior part of the tongue. The posterior 1/3 of the tongue is in the pharynx, right? In the oropharynx. So this part is the nasopharynx. This bit here from the top, from the superior aspect of the soft palate to the tip of the epiglottis right here, right? Okay, that is the oropharynx, and it'll be telling you all the things that are in there, and then right down to the cricoid cartilage, right? Okay, right. It will be in the will be in the it is the laryngopharynx, right? Okay, so you should know some levels, right? So the nasopharynx, right? Okay, extends from the base of the skull, right, to the top of the soft palate. Just remember, the soft palate is like a curtain. It's called the velum. Sorry. Number one, so you can, okay. Velum, this one, it swings back and forth. So it's going to come down to the oropharyngeal isthmus when you're chewing. And then when you're swallowing, it's going to go up here and close off the nasopharynx. Right? So this is the velum here. Right, okay? But when we measure the nasopharynx, we say to the top of the soft palate, and that's at C1 level. Then from the oropharynx is from C1, right? So that is the tip of the epiglottis, right? Okay, and then we go down to the cricoid cartilage down here, right? Okay, all right. This one has the cricoid cartilage better, right? So here you can see this. I like this one. This is the one I brought to show you, but you see every sagittal section is a bit different. This is the nasopharynx here. This is the oropharynx, but on this one you can see the palatoglossal arch here, right, going into the tongue. This one, right? Okay, and you can see the palatopharyngeal arch, and you can see the tonsil, which we're going to be talking about today. Right? Okay. Remember the tonsil, as you get older, tonsillar tissue disappears. Right? Okay. So usually most of these, look at this old man here. Right? He doesn't have any tonsillar tissue left because lymphoid tissue, you don't really need that much as you get older. It's more in children. Right? Okay. Right, so the tonsil not, or he could have had a tonsillectomy as a child, which I doubt it very much, because most of the cadavers around here, you can't see the tonsil. That's why this specimen is mine personally that I keep in my office, because there are too many of them around where you can actually see the tonsil as good. All right. So what I want to start, before we can understand the pharynx, we have to understand 4 structures, right? And the 4 structures we have to understand. The pharyngo, basilar fascia. And we need to see the attachment of that. We need to find out, we need to get to see what the pharyngeal tubercle, from which comes the pharyngeal raphe. Raphe means seam, like a fibrous seam, and muscles either arise from it or they get inserted in it. Right, in the case of the pharynx, right, I'm going to show you a picture here of a pharynx, which is from the University of Michigan. We don't have a dissection like that, but this is really, really amazing because if you look at the back of it here, what they did in the University of Michigan is that they used an electric handsaw and they took away all the cervical vertebrae back here. Right, okay? All right. Okay, all the cervical vertebrae. Right, so you're looking right in, right, okay, at the pharynx. Right, okay? And this is a posture view of the pharynx, which is very hard. I have one to show you, but not the whole pharynx. All right, you can just leave that up there. All right, pharyngeal raphe, it's right here. You can see it in the middle. That's where you can just get the impression it's right at this point here. All right, and that's where the pharyngeal constrictors, you can see the constrictors here, and they're going to be attached into the midline. We're going to show the origins of the constrictors, the three constrictors. All right, then we need to know another raphe called the pterygomandibular raphe. And we also need to know where the stylohyoid ligament is. If we understand these, then we're doing pretty well. All right. So let's start with the pharyngobasilar fascia first and show you the attachment to the skull. This is how the pharynx is attached to the base of the skull. All right. So, all right. Everybody knows this big foramen here, right? Okay. This is the foramen magnum, so everybody knows that. I know, surrounded all the way around by the occipital bone. Occipital bone has several parts, or the basic occiput. This part here that bears the occipital condyles, where the vertebral column articulate with, right? This is called the pars lateralis, and this big part back here, it's called the pars squama. Squama just means like a scale, right? Okay. This is the part we're interested in. So if we go anteriorly, right, from the foramen magnum, we can see a little tubercle here. Everybody can see it? Anybody can see a tubercle here? Evriana Hilton, you've been doing my quizzes. Evriana, I saw your name in the quizzes. All right, okay, and you've been doing I saw you did my quiz. All right, okay, and somebody else here. What are the names there? Okay, some of you probably just put your initials, but I know Evriana's name is there. Right, and Amrit Mohan. Right, Amrit, yes, yeah. You're from Trinidad. I remember speaking to you on my lecture. Right, okay. Can you see that? Can you see this tubercle here, Amrit or Evriana?
Yes, Doc.
That is the pharyngeal tubercle. Right, that's where the pharyngobasilar fascia is based. So if we look straight down at you, let us say this is coming right down. This is the fibrous seam running right down from that pharyngeal tubercle, right? And that's the part in the back of the pharynx that I showed you a while ago, right? Okay, from the blue link specimen from the University of Michigan. And if you guys want to see some good dissections, go just Google blue link, which is the University of Michigan. They've put out these free dissections, which are excellent. Some of them have labels, some don't. So you can test yourself with the ones that are not labeled and then go to the ones that are labeled and see if you're right, you're correct, okay? Now that we're Now that we're doing, I'm helping you with exams now, because now that exams are online, right? A lot of us are using those blue link images. So some of these specimens, I have some of them photographed, which I've been using in my quizzes, my Socrative quizzes, and I'm so glad to see you guys are doing them. I think they're very helpful. Everyone comes with an explanation after the question. All right, okay? So this is where the pharyngeal tubercle, the pharyngeal raphe is based on. But this is where the pharyngobasilar fascia gets centered on. Pharyngobasilar fascia then runs across here, its origin, across the base of the occiput, right, on both sides. Then it jumps onto this bone. And this bone here is the petrous temporal bone. Temporal bone is very complex. There are 5 parts to it, but you don't need to know them as yet. But this one is the petrous temporal bone. I ran around here. Some people include the mastoid, so then there will be 4 parts. Some people say the mastoid is different from that. But the mastoid developed after that one. But still, right, this is one part. Then you have the squamous temporal bone. Then you have the tympanic part. Then you don't see it in this one because they're broken off. In the styloid process here, right, is part of the petrous temporal bone. Right, the styloid process right here. Okay, mine is broken off. Over the years, numbers of students troubling it, right? Okay, they've broken them off. It used to be right here. All right. Okay. Now the important foramen in the middle of the petrous temporal bone, right here, is the carotid canal. That carotid canal is very important because the internal carotid artery runs up there, right, and then it's going to go up into the skull. By the way, let me just come back to the petrous temporal bone. It's called petrous temporal because this is the same bone. This mountain here, this range of mountains here, right? So it's called the petrous temporal. This is the petrous temporal part. This is the squamous temporal part. Sorry. Off here. This is the sphenoid here. But this is the petrous temporal bone. This is the inferior part of the petrous temporal. Good Lord said unto Peter, thou art like a rock, and thee I shall build in my church. Right, David?
Mm-hmm.
Rock. All right, okay. So here is that's better. I'll actually glue it back together. So that's a lot. All right. All right. So if we go across now, we can see it's hopping onto this here, right about here. And this is a very important relation. By the way, posterior to that now, this other foramen you're seeing back here in the shadows right here, that's the internal jugular foramen. Or that's the jugular foramen. That's the jugular foramen, through which the internal jugular vein comes down. Right, okay? So this is very important canal to know about because I'm going to show you a recess in the nasopharynx that runs right there. Right, okay? Because the pharyngobasilar fascia is attached right here. Right, okay? And if sometimes somebody coming with a nosebleed, and they find out it's coming from the nasopharynx and you want to pack it, and you have to use an instrument to push the pack in there. And if you're too strenuous and you push that instrument and you get into this recess here, you're going right into the internal carotid artery. And you wouldn't have a live patient after that. So it's very important to know this attachment of the pharyngobasilar fascia. Afterwards, look now, it's going to go right, okay, onto the eustachian tube now runs in this sulcus right here. The sulcus here, it's called the sulcus tubi. That's a very, very good picture of it right there. Sulcus tubi. It's between the petrous temporal bone and the greater wing of the sphenoid. Right, okay, that's foramen ovale there in the greater wing of the sphenoid. Right, so it runs along the sulcus tubi, then it goes down to this now. This is the medial pterygoid plate, and this is the lateral pterygoid plate. Medial pterygoid plate, lateral pterygoid plate. You have to know them because the muscles of mastication are attached to them, and also the pharyngobasilar fascia is attached along here. Right along here. And then this part of it now, very nice, this is the hamulus. Right, this is the hamulus. Right, okay? That's the pterygoid hamulus. right? Okay, so you have to know all that, okay? All right, so it's very important to know the attachment of the petrous temporal bone. Now, the two little areas I'm going to show you, but I'm not going to keep going back to the skull. But this is the inferior part of the petrous temporal bone, and this is the apex of the inferior part. It ends right here. That's the foramen lacerum there, right? And this is where one of the palatine muscles, the levator veli palatini, arises. Right? It doesn't have a name for that area. It's just the apex of the inferior part of the petrous temporal bone. Right? Okay, right here. And then if we come down to the base of the medial pterygoid plate, right here, we see another little fossa right here, and it's called the scaphoid fossa. Don't mix it up with the pterygoid fossa, which is in there, the scaphoid fossa. And that's where the tensor veli palatini, right? Which we're going to show you this morning, which I mentioned in the lecture. But remember, one elevates the soft palate, right? Okay. The tensor is attached here. They also have an attachment into the nasopharynx right at this point. Right, okay? Let's leave that for the time being and go on now. See if we can show you the attachments of the superior constrictor. If I look, what I'm going to do is show you the attachments on an image, and then I'm going to show you what parts of the constrictors you can see on the specimen. All right, okay? Because most of them you can't see them. All right, okay? Because there are other structures in the way. There we go. All the way left back. Okay. So this is a sagittal section here with the other things that I was going to tell you about was the pterygomandibular raphe. Right, okay, so this pterygomandibular raphe, it's going to run from the hamulus, right, okay, to run from the hamulus right here. All right, from the hamulus here, it's going to run to the upper part of the posterior. This is the mylohyoid line. This is the mylohyoid groove. Right? I know that you haven't done the lab on the oral cavity, and that's not good enough. Right? You understand me? That should have been done by now. Okay? All right. But I understand arrangements have been made to have it done. All right. Okay. We had some difficulties last week with lockdown and all that. So that might have caused it. I don't know. Right. But the pterygomandibular raphe runs from the pterygoid hamulus here to the upper part of the posterior aspect of the mylohyoid line. Posterior aspect of the mylohyoid line. Okay. So that's what we see in here. Right. So here we have the superior constrictor. All right. Superior constrictor arises, right? You see, these constrictors, their origins are not anteriorly, they're anterolaterally. Because if you remember, the anterior part of the pharynx is absent, okay? It opens into cavities. So they're going to open anterolaterally. They're going to, have the origins anterolaterally. So this is having the superior constrictor, which is this one. There are three constrictors, and they are the main part of the muscular wall. Superior pharyngeal constrictor, a middle pharyngeal constrictor, and one which you can't see on this really, but I'll show you on the specimen. That's the one you can see easily on the specimen, right? Is the inferior constrictor. All right, okay? All right, so this is the superior constrictor here, and this is the middle constrictor. Superior constrictor really has four origins, but the one you really need to know is that it arises from the pterygomandibular raphe, right? Okay, but it also has an origin from the pterygoid hamulus. It also has an origin right here, right? Okay, from the mylohyoid line, which is right here. So the continuous origin. So this is a part of it here, and it also has a little origin on the posterior part of the tongue. All right, okay. So it's, but this is the one. If we're asking you a question, you have to know that the arises from the pterygomandibular raphe. About, right? So what these muscles do is that it's going to come encircle. First of all, this is the origin up here that you're seeing of the pharyngobasilar fascia. The constrictors don't go all the way up to the base of the skull. So the origin at the upper part is the pharyngobasilar fascia. Then that is going to run inside the cylinder muscles, which consists of 3 constrictors. This one is the superior constrictor. This is the middle constrictor, and this is the thyropharyngeus part of the inferior constrictor, right here. All right, okay. All right, and so I've all shown you these in the exams already, right? Again, this is the middle constrictor here. It's inside of the inferior constrictor. Superior constrictor is inside the middle constrictor. It is inside the inferior constrictor. They're stacked up one on top of the other. Now there are also 3 small muscles, but they are not a significant part of the wall, right? This is one of them here, you see it from outside. This is the stylopharyngeus. That's going to pass into the pharynx inside and going to run down inside the constrictors, right? Okay, so the longitudinal muscles in the pharynx, they're going to be running inside the constrictors, but they're not any. I'll just show them to you in the specimen. They're not any arms, right? Okay, so that's the superior constrictor. If you come to the middle constrictor now, we look at this. All right, okay. Here, this is the styloid process, and this is the hyoid bone. This is the lesser cornu of the hyoid, and there's a greater cornu. The ligament that runs from the styloid process to the cornu. By the way, hamulus means hammer, and cornu means a horn, right? A horn, okay? Like a horn, right? Okay, and it runs to the lesser cornu, right? Okay, of the hyoid bone, and that's the stylohyoid ligament. So now that is a question that had the worst mark. Almost everybody got it wrong. I showed you an image of the styloid of the hyoid bone and the lesser cornu, and I asked what muscles arise from here, and very few people got the middle pharyngeal constrictor. Some people put superior, some put inferior, right? But it arises from the inferior part. So let us say that's this stylohyoid ligament. It arises from the inferior part of the stylohyoid ligament, from the lesser cornu, and from the full length of the greater cornu. Of the hyoid bone. I have a small hyoid bone here, right? Okay. This is about the size of the hyoid, okay? So this the stylohyoid ligament will be going into that. So it will be arising from, let us say, this red part of the stylohyoid ligament from the lesser cornu and the full length of actually on this is all the muscles that are arising attached to it. But you can't learn them all one time, eh? But that it arises now inside this muscle here, which goes to the tongue, and that muscle is the hyoglossus. Right, so the hyoglossus arises here, and the middle constrictor arises from the inner aspect of the length of the greater cornu. All right, now the other one that I'm going to show you on the specimen, right, is the let's take this off. Remember, this is the thyroid cartilage, right? Okay, The other thing you should know is some levels, right? Okay, and we went over them in the lecture, right? Okay, remember the level of the cricoid cartilage is at C3. The upper part of the thyroid lamina is at C4. The lower part is at C5, and the cricoid bone is at C6. Always remember that the common carotid artery is going to divide into the internal and external carotid arteries between the level of the hyoid and the superior level of the thyroid cartilage. Well, this is the oblique cartilage. And along this whole length of the oblique line here arises the inferior constrictor. Now, the inferior constrictor is two muscles in one. It has the thyropharyngeus, mainly into the raphe, whereby the cricopharyngeus just encircles the junction of the pharynx and the esophagus. And the cricopharyngeus is really called the upper esophageal sphincter. Right? Some people call it the pharyngeal sphincter. Some people call it the pharyngo-esophageal sphincter. But it is a part of the inferior constrictor. Right, okay? But it's right at the junction with the esophagus. Right, okay? So that thyropharyngeus arises along here. Then it arises on the fascia from this muscle, which is the cricothyroid muscle, which you remember from respiratory. And then the cricopharyngeus now is going to arise from the anterior arch of the thyroid, of the cricoid cartilage. Remember, the cricoid cartilage has an anterior arch and a posterior lamina, right? So it arises from here, and then it's going to go all run posteriorly and then medially, right? Okay, to be inserted, right? Right. So when they come from the origin, so just remember the origin of the superior constrictor, the origin of the middle constrictor, and the origin of the inferior constrictor. Right? As they go backwards, their fibers radiate like a fan. So the superior constrictor fibers are going to, let's take the middle constrictor, this one. See how the fibers radiate up and down. But these fibers are going to radiate right here. Right, okay? And this is the cricopharyngeus down here. Right, okay? Right? There's a little weak area between them, which we call the dehiscence of Killian, or Killian's dehiscence, right here. I'm going to show it to you on the red specimen. All right. Okay. All right. And this is the raphe. We went over all this, right, okay? I just wanted to show you. All right. Now, if we look on this image, let's go back to this one here. This is from last. All right, okay? So here we're seeing two things. We're seeing the stylopharyngeus passing between the superior constrictor and middle constrictor to go into the inside of the pharynx. And I'm going to show you that in a little while. Right, when we come to talk about the longitudinal muscles. Right, and this, what you see in here, is the end of the greater horn of the cornea. So if you see a muscle, right, between where this comes in and where this is, then that's middle constrictor. Right, you really can't tell the difference between them except that. And then above where the stylopharyngeus come in, that is mainly superior constrictor. And anything below this here is inferior constrictor. So if we look, we see the stylopharyngeus coming in here, right? And this is the tip of the greater cornea of the hyoid bone. Body would be in front, anteriorly. So the superior constrictor, this is pharyngobasilar fascia you see up here. This is superior constrictor here, right? Okay. So between superior constrictor up here, between here and where that comes in, the stylopharyngeus, right? That will be middle constrictor. And what you see going up here now, that's the thyropharyngeus part of the inferior constrictor. The cricopharyngeus will be right about this level here. And this area here is a weak area that they call it dehiscence of Killian, of Killian's dehiscence. All right, okay? All right. I'll have one more image there, which is very good also, because it shows you a nerve, but you don't get to see in any one of the specimens because it's difficult to find it. How they found it, I don't know, but this is the foramen magnum. So they've removed the back, they've removed the cervical spine. We look at the base of the skull, that's the foramen magnum. That's the medulla oblongata coming in right here. That's been to the superior constrictor, to the middle constrictor, and anything below.
Recording stopped. Recording in progress. Gabriel,
Sir,
yes?
by the way, we didn't hear about almost 10 minutes of your lecture if you was lecturing because it dipped out.
My lecture?
Well, the demonstration that you just did, we didn't see of it because the
Okay.
internet connection was gone.
Okay. We realize that the internet connection is gone, but yeah. So we haven't been. We took a break, so I don't think you really missed much, huh? Because we saw it right away. So all right. So I was just showing you this. What you were seeing this a while ago. You saw this image.
Yes, sir, but it started to go a little bit with the
All
picture.
right. So I'm saying that we need to know. Now there are two from what I've shown you. There are two constrictor gaps, right? There's a constrictor gap between where the superior constrictor arises and where the middle constrictor arises. And I thought I had another image, but I'm certain you remember it from the lecture because the inferior constrictor arises from, this is the inner aspect. There's a sagittal section. So this is the inner aspect of the thyroid cartilage. So the inferior constrictor would have arisen from the ovidicline, which would be out here. So there'll be this gap between the origin of the superior constrictor and the origin of the middle constrictor. This one is called the superior constrictor gap, and this one is called the inferior constrictor gap. I had another image from the side that I just put it. Like for me, I just don't know. I brought them all down together. Right, but I picked out some of the stains from previous. Anyhow, so those are the constrictor gaps. So you have to know what fills in those gaps. All right, okay? So if we look, right, we know that. Oh, showing you here with the style, the style. Well, let's leave the constrictors now and move to the longitudinal muscles. There are three small muscles that they arise. One arises from outside the pharynx and goes into the pharynx. The other two arise, one from the palate, one from the soft palate, and one from the eustachian tube. Right, okay? So this one is called the stylopharyngeus. Right? So it's going to arise from high up on the medial surface of the styloid process, right here. And it's going to run down from outside, and then it's going to go into the pharynx, right, between the superior constrictor and the middle constrictor. And the nerve that goes in there with it is the glossopharyngeal nerve. Right, this is a third arch muscle. So this is the only muscle in the pharynx, or two muscles in the pharynx that are not supplied by the vagus nerve. This is supplied by the same glossopharyngeal nerve that goes in there. Right, okay? So this from the, and this is going to run in. This is the same one that we saw coming down here with the glossopharyngeal nerve. Right, how they got the glossopharyngeal nerve looking like that, because it is one of the most delicate structures to dissect, right, okay? And it doesn't last too long after you dissect it, but it's here and here, right? This is a nerve that is sensory to most of the oropharynx, right, okay? To the mucosa of the oropharynx. We have to talk about the innervation. So we have a lot to cover, right, okay? So this is the stylopharyngeus here, right, coming in. And as it comes in, this is what it does. It comes in through the constrictor gap. Look here, guys. All right, comes in through the superior constrictor gap, and it runs down inside the pharynx, inside it, right? Inside the constrictors now. But they're not big muscles. You can see them. This is the three I made. This is stylopharyngeus, this is palatopharyngeus, and that's salpingopharyngeus. Right, okay? Stylopharyngeus arises from, as I showed you, from outside, and it's going to come in the constrictor gap. All three of them are going to come together, but from anteriorly to posteriorly, it will be stylopharyngeus, palatopharyngeus, and the salpingopharyngeus. They come in and they get attached to the posterior aspect here of the lamina of the thyroid cartilage and the upper cornu of the thyroid cartilage, and they also interdigitate with the constrictors at this point. So that, look at them, there are three small muscles. The function of those muscles is that at the start of swallowing, they are going to lift up, they're going to pull up the larynx and the pharynx, and the pharynx tends to open up as it goes up, right? Okay, it gets a little bigger, like broader, right? So they are going to elevate the pharynx at the start of swallowing. And if you were to put your hand on your thyroid cartilage now and swallow, you'll see the whole thing moves up, right? Okay, but just similarly, the pharynx is moving up also, because these these longitudinal muscles are attached to the thyroid cartilage and interdigitate with the constrictors. This one comes from outside. This is the most interesting lot now. So that's the stylopharyngeus. And I'm going to show, you can't see this one, but I'm going to show you this one and this one. All right, okay? So here now is the palatopharyngeus. This is the posterior pharyngeal arch. All right, okay? Or it's just called the palatopharyngeal arch, or the posterior fauces, which I showed you earlier. All right? So this runs down here and it's going to raise a fold of mucosa, which I'm going to show you in a while. And this is the palatopharyngeus. It has the three parts to it you have to know. It has the two parts running down here. There's an upper part which arises from the hard palate, and there's a palatine aponeurosis that runs right here. All right, okay, that these muscles are attached to. All right, okay, and then it runs down here. There's another part posteriorly, which comes from the posterior part of the palatine aponeurosis, and it runs down. But there's a third part, which is very important. Those little fibers you see going there, everybody can see them? Some fibers don't come down into the pharynx. They encircle the pharynx at the junction of the nasopharynx and the oropharynx. All right, so that's part of the palatopharyngeus. Now that, these muscles are contracting, this is going to raise a fold of mucosa on the muscle called passivans ridge. You've done this already when you did respiratory, right? Okay, so there's nothing new, all right? Passivans ridge. So when you're swallowing now, I'm going to show you some of the palatine muscles. This is the levator, all right, okay? Veli palatini here, the one that I showed you arising from the inferior aspect of the petrous temporal bone. This is going to lift up the pharynx, lift up the soft palate. Then we have another one coming in here called the tensor veli palatini, which I'm going to show you. That's going to tense the soft palate, and then this part of the palatopharyngeus is going to raise up this fold of mucosa called passivans ridge. So when the soft palate goes up, right, it's going to close off the nasopharynx completely, right? It's going to close off the nasopharynx completely, right? This really wasn't meant to. I just brought it out to show you the soft palate. This is the soft palate here, right? Okay. So when right, this is going to close off, right? So when you elevate the soft palate, it's going to close off the nasopharynx. If not, you'll be food and drink, everything will be going up in your nose, and you'll be snorkeling and coughing all the time, and it's not good to have food coming out of your nose, right? Okay. So that sphincter that I showed you right there, right? Okay, that's caused by this part of the palatoglossus here. Palatopharyngeus, sorry. Palatopharyngeus is called this bit here is called the palatopharyngeal sphincter. But not just this, the whole area there is called the palatopharyngeal sphincter. All right. So what else runs through the superior constrictor gap? I'm going to ask Evriana Hilton. I did my quiz, Evriana. What are the 4 structures that run through the superior constrictor gap?
The stylopharyngeus, styloglossus, glossopharyngeal nerve, and lingual nerve.
Excellent, excellent. Mr. Bugard would say 300%. Very, very good, right? Okay. Remember that only one of them is going down into the pharynx, right? Okay, and that's the stylopharyngeus. The other 3 are going there, but they're going to go anteriorly to the tongue. Styloglossus is going to the tongue. Lingual nerve is going to the tongue. The glossopharyngeal nerve that we saw here earlier, right? This is going to give some fibers, right, to a pharyngeal plexus of nerves on the back of the middle pharyngeal constrictor here, but it's going to go forward and it's going to supply the posterior 1/3 of the tongue and the oropharynx, the mucosa of the oropharynx. That's mainly sensory. The only muscle that's supplied by the glossopharyngeal nerve is the stylopharyngeus. All right, okay? All right, now, what are the structures that run through that occupy the inferior constrictor gap? This goes to Amrit Mohan. Amrit, come on. Amrit, Evriana again then. Evriana?
Well, the thyroid membrane is found there, and the internal laryngeal nerve pierces it, as well as the superior laryngeal vessels.
Brianna, that's excellent, excellent. All right, and let me show you that, okay? All right, so at least I have something I can show you. So the hyoid bone, this little hyoid bone I showed you here, right? This is hidden right up here. I can feel it. The thing, but it's in a mass of muscle, so I can't, right? Okay? You really can't see it externally. But what you're seeing here, right? Okay, this is the thyroid membrane. This is the upper end of the thyroid cartilage, and right up here now, in this mass of muscle here, is the hyoid bone, right? Okay, this little bone here is stuck right in there, like that. Okay, right? Okay, and all these muscles are attached to it. I'm going to show you some of them in a while. All right? Okay, has 2 other structures, so that occupies the gap between now. This is the inferior constrictor here. Sorry, the inferior constrictor, right? Right. Those fibers you see coming off here, they come in from the oblique line on the thyroid cartilage, and they're running right around, right? And they're going to come right around, and they're going to come right around like that, and they're going to get inserted into the pharyngeal raphe, right? Okay. Pharyngeal raphe, right? At the back of the, what is happening is that I've opened up my pharynx posteriorly. Let's get it better. Yeah, right about here. Right, opened up posteriorly, so it's going to be attached into the raphe right here. Right, okay, so that's the inferior constrictor you see in there. You can see the fibers going here. Right, okay, right. Now, look at the other things now. Let's see if we can find that. The other two things you mentioned. Tell me what's the other one? Okay, this here is the common carotid artery. Common carotid is going to divide into the internal carotid. You can see it's the internal carotid because you see this bulb right here is the sinus of the carotid sinus. And this you have baroreceptors and you have chemoreceptors right in between here. But that's for neuro. You don't need to know anything about that right now. This is the one you need to know. This is the external carotid artery. How many branches come off of it? Plenty. 8 branches, all right, okay? I'm going to show them all to you today. If Mr. David would allow me to. All right, so this is the superior thyroid here, because this is the thyroid gland. So you can see the superior thyroid artery coming down here, right? Coming all the way down here. Runs with the external laryngeal nerve. But you don't need to know that until later in the semester when you do endocrinology. Coming out from it is this branch. Who can tell me what the name of this? It's going to pierce the thyroid membrane. What is the name of it? One of the blood supplies of the larynx and the pharynx. It's called the superior laryngeal artery. Didn't you say that, Evriana? Evriana?
Yes, sir.
This is superior laryngeal. So look where it pierces. It's piercing it right here. Now this nerve, what's the name of this nerve now, Evriana?
Internal laryngeal.
Internal laryngeal nerve. Is this sensory or motor?
I think it's sensory. I don't know.
Totally sensory. Totally sensory. It's going to go in there, right? And it's going to supply the supraglottic larynx all inside here. This is the adytus. We haven't come to the features of the internal side of the larynx as yet, but you did all this in the lecture. So all of here. Then, anybody can tell me what the name of these two little, this is the back of the tongue here. This is the posterior 1/3 of the tongue. I wish I had time to get into the oral cavity. If I get into the oral cavity, you can't get me out. I've been there for hours and hours, okay? But this is the, everybody knows the epiglottis. So what are these two depressions called? Behind the posterior 1/3 of the tongue. See, that's what happens when I have to do a lab, when the person who should have done the oral cavity has not done the oral cavity. And that's a shame, right? Why will you complain? Hope you've been sending letters to the head of the department. Right, okay, it's not good enough. Right, okay? What's the name of this cavity? This the depression here. Anybody? The vallecula. That's right. Those vallecula, you know, that's in the oropharynx, as I'm going to show you, because the oral cavity ends at the palatoglossal arch, right? Okay, and the posterior 1/3 of the tongue is the anterior part of the oropharynx, right? Okay, so it's sensory to this supraglottic larynx, the valleculae. And who can tell me now from respiratory what's the name of this depression right here in the laryngopharynx? Sometimes a foreign body gets in there and you have to try and get it out. Anybody remembers the name? Piriform fossa. Anybody remembers that? Evriana?
Yes, doc.
Okay. So those are the three things that sensory. Well, not only that, it goes on and it provides the sensation for the laryngopharynx. Right? Okay. For the laryngopharynx. We'll talk about the sensations when we do the innovation in a little while. Okay. So that internal, right? Okay. Internal laryngeal nerve is very important. Three things, right? The supraglottic larynx, the valleculae, right? Okay, and the piriform fossa and the rest of the laryngopharynx. Who can tell me what's the sensory innervation of the oropharynx? No? Okay. All right, we'll come to that in a little while. All right, so just remember now what goes through the inferior constrictor gap. All right, okay? That is the what fills in the inferior constrictor gap. The thyroid membrane, these are the questions that come, eh? The superior laryngeal branch of the superior thyroid artery and the internal laryngeal node. Though, where does this internal laryngeal nerve come from? Anybody knows? Everyana?
Superior laryngeal nerve.
Yeah, it comes from the superior laryngeal. And that two main branches of the vagus nerve that are in the neck, they come off from the inferior ganglion of the vagus nerve, but you don't have to know that as yet. Right? One is called the pharyngeal branch, which we're going to talk about next. Right? Okay? And the other one is the superior laryngeal nerve. That superior laryngeal nerve, so if it has an internal branch, then it's going to have a branch that runs down here, which hard to see. I think it's there, but I don't know really. Not as easy to see. This is the superior thyroid artery coming down here. It runs with this. And when you're doing a thyroidectomy, sometimes you have to be careful that you don't divide that. What's the name of that branch? If one is internal, that's what? So you have an internal laryngeal and a
External.
right. And what muscle does the external laryngeal supply? You forgot your respiratory already? The cricothyroid muscle. Remember that's what helps you to raise these high notes. Okay, so when you dissect in the upper pole of the thyroid gland, you have to be careful how you divide the superior thyroid artery, because if you you can't see it, so you have to know where you're going. Really, basically, it's not easy to see, like the internal laryngeal. It only supplies one muscle. That muscle is right here, so right, the cricothyroid muscle right here, right. Okay, and when that is paralyzed, right, you can't raise you can't get those very high notes. So it's called after a famous opera singer. She had a thyroidectomy done under local anesthetic back in early part of like 1900. And afterwards, she's a special soprano. I can't remember what they call it now, the type of soprano, but she could go very, very high. And she couldn't get those high notes again. In those days, I suppose they couldn't sue or anything like that. But the nerve is called after her. The name slips me right now. Right, external, it only supplies one thing, and that's the cricothyroid muscle. All right, so now where are we going to next? All right, yes. Oh, I want to show you something there. I know you haven't done the oral cavity, right? Okay, but let's look at some of the things that are attached to the hyoid bone. These are the infrahyoid muscles. So what you're seeing coming down here, this is the sternohyoid from the back of the sternum, right? Okay, from the back of the manubrium sternum, come right up here to the anterior part of the hyoid bone. This is the omohyoid. That's sternohyoid here, omohyoid here. Right, okay? Right, then going up now, right, we have these two muscles. Anybody can tell me what they are? See, you don't know the oral cavity, yeah? And that's a shame. What is this? It has two bellies, one anteriorly and one posteriorly. And it has an intermediate tendon. All this should have been done in the oral cavity, because it's in the floor of the mouth. Intermediate tendon supplies it, right? Connects the posterior body, right? Posterior body is right here. See it? Posterior body. This is the stylohyoid muscle you see in here. It goes through the stylohyoid. It has a ligamentous connection to the hyoid bone, right? Right. The stylohyoid is attached to that, and the intermediate tendon runs here. Anybody knows where the omohyoid is attached? You get me out of the pharynx, right? Okay. Right. So this is the digastric fossa, right down here. Right. So they're attached right here. Right. Okay. The digastric fossa. Right. Okay. Then we have these two tubercles here. What are the names of them? Anybody knows? Everyone?
The genial tubercle.
Genial tubercle, superior genial tubercle and the inferior genial tubercle. Which one is it? What muscle comes off the inferior genial tubercle? Which one comes off the superior? Okay, I'm going to show you so you don't forget that. That's not up in the pharynx. Eh? So, first of all, the next muscle we meet after you seeing this one is this. Everybody recognize this muscle now? That's the floor of the mouth. What's the name of that muscle?
Mylohyoid.
Mylohyoid muscle, right? It arises from the mylohyoid line, right? All the time, straight out the pharynx, right? From the mylohyoid line right here, all the way up, right? Okay, and then posterior 1/4 of it, right, is inserted right here, right? Okay, and the rest of it goes into a raphe. That's a raphe you're seeing in the middle there. I don't think you see a better specimen than this one. That's a raphe right here, the mylohyoid. So that sits there, and that's the floor of the mouth. Then we have these two muscles now. Who can tell me what they are? They are attached to the inferior genial spine. Which ones are they? Genial tubercle. The inferior genial tubercle. And this is the genial hyoid. The genial hyoid. Then this big muscle now that goes into the tongue. Right? The biggest muscle in the tongue. It pushes the tongue out. So somebody tell you to stick out your tongue. This is the muscle that sticks out your tongue. What's the name of it? Everyana. Sorry.
I don't remember. I don't remember.
This is the genioglossus. This is a big muscle in the tongue, genioglossus. All right, okay? So I'm just showing you these because I don't know if you get a chance to see them again. I hope I understand the arrangements are being made to do the lab. All right, okay? So hopefully it's done. All right, okay, soon. Okay? That's up in the that's the floor of the oral cavity. All right, let's get back into the inside. Okay, so let us start and look and see what some of the things that we see in the nasopharynx. Anybody knows? What is this? What's this area called? This projection in the nasopharynx. It's a mountain, a little bit of a hill. What's it called? The torus tubarius. This is the tube. This is the eustachian tube open here. So the torus tubarius. And did I show you? Or did I? I have so many things to show you. I forgot to show you this muscle. Right? This is the third longitudinal muscle. All right, okay. This is the eustachian tube here. And with cartilaginous, the mucosa of it there. And this is attached onto the eustachian tube and runs down inside the pharynx now. All right, okay. All right, okay. And that's the salpingopharyngeus. So we have the stylopharyngeus, the palatopharyngeus, and the salpingopharyngeus. Now, although it's the smallest of the lot, it's the one that's most commonly asked about. Because a lot of time in the exam, the pin is put into that fold. And they ask you, what is that fold? Who can tell me what fold that is? The muscle name is the salpingopharyngeus. So it's called a
Salpingopharyngeal fold.
muscle name is the salping fold, right? Okay, so that one is easily seen. Let me show you inside view. Right, you see, I bring these because you guys need to look at these Netflix images, you see, because having specimens to look after. I really feel sorry for you, because I feel that, and David can tell you that too. David started medicine and then decided that he was going to go into IT, and I think he's done better in IT than he would have done medicine. He's headed the IT department, okay, all right up to the top, right, okay, right, but. What do you do, David? Do labs? You did labs and all that, no sure? So second MB, you started. St. Augustine, yeah. Right? So what, right, okay? What I'm basically saying is that that's where you're learning anatomy in the labs. So even in the exam, they're not going to get specimens like this, right, okay? You're going to get pictures, right? So you better study the pictures, right, okay? But the same thing I showed you there, that's what you're seeing. This is the nasopharynx up here, above the soft palate, right? And that's the torus tubarius, and this is the salpingopharyngeal fold right there. All right, okay? So you need to see that. All right? All right, now, let's take this out and leave one in. All right? A little mound is often right on the same torus tubarius, right here. All right? A mound of lymphoid tissue. And it's called the tubal tonsil. I'm going to be talking about that tonsils in a little while. Tubal tonsil. Right, okay? Right here. Right, okay? Then, see, these cadavers are old people, right, okay? Right at the back here now, you have more lymphoid tissue. Or anybody can tell me the name of it? Anybody ever had a teaser nails out?
The adenoids.
The adenoids, yes. So this is called a pharyngeal tonsil. Pharyngeal tonsil. I'm going to tell you about tonsils in a while. Now this here now. See where I put my instrument there? What's the name of that? Everybody should know that. Michaela is the head of the group, right? Okay, Michaela? You don't keep in touch with me often enough, Michaela. Just let me know, right? All right, keep in touch with me. You're the head of the group. So I can send out put up the Socrative quizzes for you guys. Michaela, you know the name of that recess? Yeah? You see how dark it is in there, like a alley. And if you're doing instrumentation in the nasopharynx, then you have to pack the gauze pack all the way in there. And if you push your instrument too hard like that, what artery you going into? Usigem Ukala. Evriana, what's the name of it?
It's the pharyngeal recess of Rosenmuller.
Of Rosenmuller. Very good. Evriana, where are you from?
Jamaica, Westmoreland.
Jamaica. Westmoreland, very good. My favorite places down there.
Definitely.
Right, okay? Right, yeah. And lovely, yeah. Right now they're battling with some COVID cases and things down there. So, all right. So you stay safe, huh? You vaccinated?
Yes, sir. Fully vaccinated.
Well, that's why I want everybody to get vaccinated. I want us back together. I rather teach you in a classroom, in a lab than on Zoom. Seriously. All right. So that's the pharyngeal recess of Rosenmuller. So you're supposed to know, right? The torus tubarius, right? It has a tonsil on it, right? Okay. And it has the salpingopharyngeal fold and the pharyngeal tonsil or adenoids back here. I can't see them much now because, okay. Now, so we come out from that now, and I'm going to go to my specimen, which I keep because it's better than anything else around, because it shows you, right? So we're in the oral cavity here, right? So this guy is the dentulus. He doesn't have any teeth. So anybody can tell me what's the space called? outside the gum line. What is this called? The oral cavity. Oral cavity has two things. It has an oral cavity proper, and then it has a space between the cheeks and lips and the teeth and gums. Right up in here. What's that called?
Vestibule.
Vestibule. Yeah? So the vestibule in there. These are simple things, you know. You have to know, right? Okay. I have one to show you, which is really even better. Which one is it now? This guy. This one. My favorite section because I've opened up the infra temporal fossa, so you can see the buccal nerve, the long buccal nerve, and the lingual nerve and the inferior alveolar nerve. All right, okay, but that's not for now. This is a bit of the parotid gland on the masseter right here. Right, okay, and this is Stenson's duct. All right, okay. So if we pull on Stenson's duct and we get into the vestibule opposite the second upper molar, right? Everybody can see that little hole right there? Huh? Everybody can see the little hole in the middle there?
Yes, sir. Yes, sir.
Right. Everybody tell me what opens right there? As the parotid gland opens there, to Stenson's duct, okay? All right, so that's in the vestibule. By the way, we lift this up, what my fingers on here, this is the buccinator muscle. So if we go posterior to this, the superior pharyngeal constrictor is going to come off from one side, and this comes off anteriorly of the pterygomandibular raphe. All right, okay?
Sorry, could you move the right and trust the buccinator again, please?
Buccinator. Like this. All right, this is the buccinator here. Muscle here. All of this. That's the muscle that's in your cheek. So you burn up a balloon and you're using that muscle, all right, okay? All right, okay, and that helps you to blow. Some people like to blow lots of different things, eh? But I'm not going to go there today. All right? I just think of a balloon, right? That's not the But it's also serves another very important function because we want it for this muscle, right? Right? It's the buccinator. Then it's what keeps the food out of your vestibule. If not, when you chew it, the food wouldn't be in the middle of the oral cavity, right? It'll be in the vestibule. And that wouldn't be very nice, eh? That's between the gums. And so this is the important of this. Important thing to always remember that although the long buccal nerve runs down on it, the long buccal running down here. And all this they should have done in the oral cavity, you know. The oral cavity you have to do lip, cheek, tongue, right? Okay, right? A lot of things to do. Then all these muscles of mastication up here. There's the lateral pterygoid, there's the medial pterygoid. This is the temporalis, right? All those things should have been shown already, right? You understand me? So this nerve, all that runs on it, it's sensory to it. It's not motor. The buccinator is the facial nerve. That supplies the buccinator. The buccinator is a muscle of facial expression, right? Also, okay. So it's not a. This is sensory. This long buccal nerve, which comes from the mandibular branch of the trigeminal, right? Is going to be supplying sensation. This is sensory. Remember, the trigeminal is mainly sensory. Yeah? So it's sensory to the mucosa of the cheek inside, the skin of the cheek outside, and it also has proprioceptive sensory fibers, so the buccinator muscle. All right. Well, let's get back now to the oropharynx. We still have the esophagus to do. All right, okay. Okay, so we're going to do the oropharynx now. So the oropharynx, right, is that part between the. If we look here now, guys, this is the tongue. So this here is the palatoglossus muscle, which you haven't seen as yet. This is called the palatoglossal arch. And this is the palatopharyngeus muscle right here, the palatopharyngeal arch. Right, okay? So this is the boundary between the tongue and the pharynx. And then remember, everything back here is oropharynx, right? Okay. Now, this is called the tonsillar fossa, right? So the tonsillar fossa is in the oropharynx. The palatine tonsil is in the oropharynx. Now, if we look at the posterior one-third of the tongue here, anybody can tell me what is this tissue we're seeing here? This is the anterior one-third, which has all the lingual papillae and all that. The posterior one-third. What are we seeing there? Okay, so what you're seeing here is the lingual tonsil. This is tonsillar tissue again. Tonsillar tissue, when we talk about a tonsil, we talk about an accumulation of lymphoid, of lymphocytes, right? Okay, and right in the under the mucosa, right? Okay, and they guard, right? There are 4 sets that we'll see, right? This is the lingual tonsil at the back of the tongue, posterior one-third of the tongue, the lingual tonsil. Here is the palatine tonsil between the 4 C's of the palate here, right? Okay, right? Okay, palatine tonsil, palate is here, right? And here we have on this we have the tubal tonsil, and this is the adenoids, right? Okay, or pharyngeal tonsil. So what's the name of that ring of tissue?
Waldear's ring.
Waldear's ring, right? Okay, it guards the aerodigestive system, right? Okay, so any microorganisms that come in there, there's a good there are lymphocytes there that are going to try and stop them, right? Or at least to deal with them as they go in, right? Okay. All right, it's very important to know that. So when we talk about the palatine tonsil, we're talking about this structure here now, which is in the tonsillar fossa, right? Okay. Then this part, all of this is oropharynx. Then all of this is oropharynx because here, this is the tongue here. This is the anterior 2/3 of the tongue. What you see in here is the sulcus terminalis, right, between the anterior 2/3 and the back of the tongue. And this is the lingual tonsil you see in here. And here we can see the valate papillae, the big valate papillae along here, or circumvallate papillae. Right, okay, then here you have the little filiform, fungiform papillae, and you have the filiform papillae up in front here. Okay, and all right, so all of this here is oropharynx. Okay, then as we open down here now, we're seeing the laryngopharynx. And what you see in the laryngopharynx is epiglottis. These two, anybody can tell me what cartilage are? This here is the lamina of the cricoid cartilage. What 2 cartilages are right here? Anybody can tell me that? 2 cartilages that sit on the cricoid.
Is it the arytenoid?
The arytenoid. So what's the name of this fold that runs from the epiglottis to the arytenoids?
Aryepiglottic fold.
Aryepiglottic fold. Okay. So all this is right. That's the entrance now into the larynx. Right. Okay. So entrance into the larynx. So this is the laryngopharynx here, and you have to know these 2 areas here. These are the piriform fossa. The reason you have to know them, one is that foreign bodies often go in there, and you have to take them out. Tristan tweets, you're looking very smart. I like the outfit. Tristan, where are you from?
Kingston, sir, Kingston.
Kingston, Jamaica. All right, great. Okay. All right, so foreign bodies can lodge here. The other thing with here is that if you have a tumor of the pharynx, right in here, it takes a long time to present because it grows slowly in here. So those are the 2 things you should know about it. And always know the the sensory innovation. I think it's what? What's the sensory innovation, Tristan?
Hold on, sir. I'm actually taking in most of this right now. So I don't think I can answer most of these questions right now.
Okay, that's the internal, Everana told us, the internal laryngeal branch of the superior laryngeal nerve. What you guys have to do, you can't just read. If you read, you'll never retain it. I want you to form small WhatsApp groups, right? Like 8 people, and just keep talking to each other, ask each other questions, right? And answer without looking in the book, right? Okay, all right? And you'll be surprised how quickly you return it, you retain it when you do that. All right. So let's talk a little bit about the innovation. Then we go to the David said I can go over a little because we had a couple of interruptions. We'll go over a little today. All right. So I want to spend about half an hour on the esophagus, but I just want to say a little about the blood supply and the innovation of the pharynx. All right. Okay. So
Quick question, sir. Tristan,
Yeah.
Just a friendly reminder that most of us or some of us are actually first year DDS. So some of me not being able to answer it isn't
I see. Okay. I just realized actually just this semester I
Yes.
realized that the DDS program has changed up, and that's very unfortunate. I tell you.
Yes.
But anyhow, that's how most DDS programs go with 1 year of basic sciences. You know? So, well, 1 year. Oh, sorry, they've cut out a lot of things like locomotor system and all that. That is unimportant.
Okay, sir.
All right. So, all right, I understand that. Okay. All right. So, based on the middle pharynx, let's talk about the nerves first. Oh yes. Sorry, I need to. How many? Let me just talk about the soft palate first before I go there. How many pairs of muscles are involved with the soft palate? Anybody knows?
5 pairs.
5 pairs. We have one here, that's the palatoglossus, which goes to the tongue. This one is the palatopharyngeus. Right, okay. Then we have 2 that I showed you that one elevates, that's the levator palatini. Right, okay, and one tenses, and the one that tenses. I like to show everything. That's the problem. I think so long with the labs. So this is the one that elevates, the levator palatini, and there's one that runs down here. It's all been marked up now. That's why. Right, okay. This is the one that arises from the scaphoid fossa. It runs down, and then it has a tendon which hooks around the hamulus and gets inserted into the side of the palatine aponeurosis. And there's the tensor veli palatini. Right, okay. Then one more muscle now, a small muscle, one on either side, and they fuse together. This is called the uvular muscle or the musculus uvuli. Musculus uvuli. Uvuli for single, and then musculi uvuli for plural. Right, it's called the uvular muscle. It's fine. That moves that little thing at the back of the soft palate, which is the uvula. Right, that's attached. That arises from the hard palate, and the palatine aponeurosis get inserted also in the palatine aponeurosis and into the mucosa of the uvula. So 5 pairs, you should know them. All of them are supplied by the pharyngeal branch of the vagus, which we're going to talk about next, except the tensor veli palatini, which is supplied by the mandibular branch of the trigeminal nerve. All right, you guys have to know these things. All right, okay? All right. Okay. So the soft palate, right? It can actually, as part of the oropharyngeal isthmus, it sort of guards when you're chewing food going over into your larynx, right? Okay, right, and that it pulls up on the back of the tongue like that, right? And you can chew without actually anything spilling over, so you can breathe at the same time while you're chewing. Once you decide to swallow, you can't breathe, right? Because you try to breathe, food is going to go up there, right? Because this soft palate now is going to move up, right? And the palatopharyngeal sphincter is going to close. So you should know the difference between the oropharyngeal isthmus, that's the isthmus between the oral cavity and the oropharynx and the oropharyngeal and the nasopharyngeal sphincter, which is the junction between the oropharynx and the nasopharynx. All right, okay? All right, so let's come down to the nerves now. The No, I forgot. Not everything right. But, all right. So in the vagus in the neck, right? Okay. By the way, let me just show you the vagus. Let's go. That's a good place to start, right? Yeah. So this is the cartilage sheet here. Right. Okay. So it has the common carotid artery, the vagus nerve, and the internal jugular vein. Three things in the cartilage sheet. Right. Okay. All right. So this is the what we're seeing right here. This is it. This is the vagus nerve here. Right. Okay. This vagus nerve has two important branches in the neck. The pharyngeal branch of the vagus, which is the superior one, and then the superior laryngeal nerve, which we spoke about a while ago. Right, okay? So the pharyngeal branch of the vagus, right, okay, that's going to run down posterior to all these, to the cartilage sheet, right, all the vessels, right, okay? Then it's going to go onto, right, okay? It's going to go in a plexus on the posterior part. Let's just put this together here. Right, on the posterior. So we agree that this about here is the middle pharyngeal sphincter, right? Because it's going to go mainly around the middle pharyngeal sphincter, right? It's going to form plexus of nerves. That plexus is going to have the pharyngeal branch of the vagus, right? Okay, which is going to supply let's do it. It has the pharyngeal branch of the vagus, which is motor supply. Then the glossopharyngeal nerve, as the stylopharyngeus muscle is going into the superior constrictor gap. That the fibers from the glossopharyngeal nerve go into it. That's going to be sensory, right? Okay, and it also has sympathetic nerve fibers coming from the superior cervical ganglia, right? Okay, so three things are in the pharyngeal plexus of nerves. That pharyngeal branch of the vagus has nerve fibers coming from the nucleus ambiguous. Now, that is a little bit beyond you. You wouldn't understand that until you do neuro. But there are two sets of fibers, of motor fibers that are in the vagus. One is what we call secretomotor, that will affect smooth muscle and glands. And the other one is what is some that arise, right, okay, that run in the pharyngeal branch of the vagus, the recurrent laryngeal nerve, okay, and also the external branch of the superior laryngeal nerve. Remember, the external branch takes motor fibers to the cricothyroid. Right? So those arise in a special nucleus called the nucleus ambiguous. So you'll understand it better when you do neuro. So remember, all these muscles are striated muscle, right? So these are striated muscle because they arise from the pharyngeal arches. They're not the smooth muscle that you get in the rest of the body, right? So that's why they have the origin of those nerve fibers come from the nucleus ambiguous. Just remember that term for the time being. Not you would know it's in the medulla, in the brain, but you'll understand it more when you do the neuro, right? So that's going to supply, that pharyngeal branch of the vagus is going to supply all of the muscles of the pharynx, the 6 muscles of the pharynx, except which one? Every honor.
The stylopharyngeal,
Stylopharyngeal, which is supplied by,
pharyngeal nerve.
no, the stylopharyngeal.
Yes, it's supplied by the glossopharyngeal nerve.
Esophagus nerve. You see, that's how I want you guys to talk. You have to have a little WhatsApp group and call each other and talk. If you don't talk this thing over, you never remember it. All right, okay? All right, okay? Now, it also supplies the 5 pairs of muscles of the soft palate, except which one, Brianna?
Is it the tensor?
Tensor palatini, right, okay? Now, the only other muscle which you need to know about that is the cricopharyngeus. Cricopharyngeus gets fibers also. By the way, this is the glossopharyngeal nerve here. So this is about right where we have the plexus. Fibers from the glossopharyngeus. Then this the coming from the vagus nerve. This is the vagus nerve running down here. Right, okay? Right here. So it's got to supply, right, okay? Branches here, right, okay? The pharyngeal branch of the vagus. And then you also have the sympathetic nerves coming in there. Right, okay? The other nerve, the other muscle that doesn't get, well, it gets supply from the pharyngeal branch, but it also gets a supply from the recurrent laryngeal nerve. I'm going to show you the recurrent laryngeal nerve next when we go to the esophagus. All right, okay? All right. Now the blood supply. I'm going to use this one here because it's easier. So almost every branch of the external carotid, which is what we're seeing here, this is the internal carotid that has no branches in the neck. That's going up to the brain, right? Okay, no branches in the neck. This has 8 branches. If we look in here, Dr. Shetty would have done the parotid gland with you, so I'm certain if you did the parotid gland, what I did here is to remove the parotid gland, so we're actually seeing the termination. By the way, if we look here, this is the common carotid, right, okay? This is the internal carotid, and this is the external carotid artery, right, okay? Where is the, what have I done with it? Yeah, here we go. Vegas, where's the Vegas? Oh, here the Vegas, right, okay? So the Vegas, right, okay, all the Vegas. So this Vegas is what's going to give you the pharyngeal branch of the Vegas and the superior laryngeal branch, right, okay? All right. And here we have the branches. So I was showing you here the terminal branches of the external carotid artery is this one, which is the maxillary artery, which is running into the infratemporal fossa, and it's running right here on the lateral pterygoid. The lateral pterygoid muscle, which I'm certain Dr. Shetty told you about because he did mastication with you, right? Okay, it's in the infratemporal fossa. So this is the big maxillary artery, right? Okay, this one going up here. If you put your fingers right in front of the ear, you feel it as a superficial temporal artery. So those are the terminal branches of the external carotid. So we have the common carotid, then that's the internal carotid, becomes the external carotid. Right? Anybody knows where it divides? The 3 arteries in the neck: common carotid artery, internal carotid artery, external carotid artery. What level is this? Between the hyoid bone and the top of the thyroid cartilage is what? C3, C4. That question comes in every exam. Then, so we saw it up there now, finishing in those 2 branches. This is the superficial temporal artery, and this is we'll go more like this, the maxillary artery. First branch it gives off anteriorly, right? is the superior thyroid artery. Superior thyroid artery, which I've shown you. Gives off a branch here, right? It's going to go in to the larynx, called the superior larynx. All these branches are going to supply not just the larynx, but the pharynx also, right? Okay? Right? So the superior laryngeal artery, right? Okay? One of the supplies. Next branch it gives off is the lingual artery. I'm going to show them to you now, right? Okay? Lingual artery has some branches called the dorsal linguae, right? So the lingual artery, right? Supplies the pharynx. Then the other one we have is the facial artery. The facial artery has two very important branches, a tonsillar branch, right, okay, and it has an ascending palatine branch. They're going to supply the pharynx. Okay, so let's see how many branches we've gone so far. 1, 2, 3, 4, 5. There's two more small branches here, which you wouldn't need to know right now. That's the posterior auricular, which you'd need to know when you do neuro, and the occipital artery, posteriorly. So posteriorly, there's two branches. Then, if it goes sitting now, there's another artery here, runs up on the pharynx, coming from inside of it. It's the outside. So lateral is medial. And that's called the ascending pharyngeal artery. Look at the branches that supply the pharynx. Superior laryngeal artery, lingual artery, tonsil, the facial artery. Even in these two branches, you can't really see them. You can see them in diagrams, right? Okay, that's the tonsillar branch, which is on the main arterial supplies of the palatine tonsil, and the ascending palatine. Then this ascending pharyngeal here, they run right up on this, all the muscles of the pharynx going right up to the top, and that supplies the pharynx also. Then the maxillary artery now, right? That has a lot of branches, right? Okay. Let me see if I have a picture of maxillary artery there. Show you. All right. Let me show you the next time. All right, that's going to give you a branch which is going to come down here and come through this opening. And you should know that opening from respiratory. What's that? What's the name of that artery going forward here? Greater palatine. What are these names? This small foramen in the back here. These three small foramina here. Anybody knows them? If that's the greater palatine, what are these? Lesser palatine. Those are the branches that supply the palate, soft palate, and the pharynx also. Then there's another branch. See, that maxillary artery I showed you here a while ago, this maxillary artery here, this one, it's going to run right here. Right, okay? Right, okay. It's going to end up in this foramen. Anybody knows the name of this foramen here? Okay, what's the name of this fissure? All the way that run down here. This is the pterygoid, lateral pterygoid, and this is the posterior part of the maxilla. So what's the name of the fissure? Everyana? Pterygomaxillary fissure. So what's the name of that fossa, not a foramen, fossa here? Because the lower part is closed off, it's called the pterygopalatine fossa. So there's a ganglion in here called the pterygopalatine ganglion, and all the terminal branches of the maxillary artery are running here, right? And some come down here. The greater palatine is going to come down here. The lesser palatine is going to come down here. It's also going to give a branch called the pharyngeal branch from the third part of the maxillary. And some come down here, which is going to run through this foramen here to come back to the nasopharynx, and that foramen is called the palatovaginal canal. Palatovaginal canal. So you see, almost every branch of the external carotid artery gives you a branch of the artery that supplies the pharynx. All right. All right. Let's move on to the esophagus. All right, and see what we can learn about it, and then we'll show you the recurrent laryngeal nerve. Any questions before we go on? I know there's a lot today. Rebecca. Monique. Everybody's so quiet. Why is everybody so quiet? Hungry? Okay, so on Monday, I'm going to be doing the peritoneal cavity, and on Tuesday I do the cardio-esophageal junction, right? And then I'll be putting up some quizzes on the abdominal wall and peritoneal cavity, and on the stomach and duodenum. All right, okay? And then after that, I'll put up the quizzes on I want you to do your lab on the oral cavity first before I put up the quiz on the oral cavity. All right, let's come to the esophagus, right, okay? So, if everybody can recognize this specimen here. So this is the thyroid, right, okay? Right, thyroid there. So thyroid finishes the cricoid cartilage here, right? And there's the trachea right here, right, okay? And this is the thyroid gland. Right lobe, left lobe, isthmus. Go right under here. You can see. That's the thyroid, okay? All right. So esophagus starts at the lower end of the cricoid cartilage. So the cricoid cartilage here, right here, and this is the end of the thyroid. Right. So anteriorly here would be the annulus of the cricoid cartilage, and back here would be the can't really see it in this. It would be the lamina. Right. Well, right at the lower end of the cricoid cartilage, that's where the esophagus starts. So we're in the pharynx up here. Right. Okay. We know we're in the pharynx because we're looking into the larynx there. Right. We can see the cords and everything right in there. Right, okay, we can see the arytenoid cartilages here. So I stick this down in the pharynx, going into the esophagus. The esophagus, what level is it? What level does the esophagus start? Everyone.
C6.
C6, right, okay? So that's a C6. It starts where the pharynx ends. Right, okay? And where does it enter the stomach?
T11.
T11, right, okay? T11. So we know that 1, 2, 3, 4, 5, this is a 6 costal cartilage. This is 7 costal cartilage. Well, this is not 1, 2, 3, 4, 5, 6, 7. This is 7 costal cartilage. Right, okay? Right? But really, it's not very accurate. This should be 1. This should be joined, the 7th right here. This is 7. 1, 2, 3, 4, 5, 6, 7. Right, okay? So behind, let's say, the 7 costal cartilage here, 2.5 centimeters, right, okay, left to the midline at T11. So it's 5, 4, 3, 2, 1, 12, 11, right? So right about here, 2.5 centimeters left of the midline at T11 behind the 7 costal cartilage. All right, okay? All right here. That's where it ends. Okay? That's not where it actually goes through the diaphragm. Though. It goes through the diaphragm, one vertebral level, higher level, same marking, same behind the 7 costal cartilage, but at T10. So it goes through the diaphragm at T10, and then it ends at T11. Right? Okay. All right. So So you need to know those. So what we need to know first of all is that we need to know there are three parts to it, right? Okay. So first of all, it's a muscular tube, right? Okay, you can see very muscular tube, right? Okay, and it has 4 layers, right? Okay, the mucosa is what? What lines the mucosa? What type of mucosa it has? Anybody? Sydney. Remember Sydney?
Stratified squamous non-keratinized.
Squamous and non-keratinized. Very good, very good. Okay. It's mucosa. It's made up of the stratified the epithelium, the lamina propria, and it also has a muscularis mucosa. Muscularis mucosa now replaces the pharyngobasilar fascia, so to speak. Right? Okay. Right. And then you have the submucosa. Then you have the muscularis. The muscularis is inner longitudinal and inner circular and outer longitudinal. And what lines it on the outside? What are we seeing here? What's that? Serosa?
Adventitial.
Adventitial. When we talk about serosa, we're talking about lining of the peritoneal cavity and squamous epithelium that lines the visceral pleura, and the visceral peritoneum and the somatic and the parietal peritoneum. Right? Okay, but here this is just adventitial all the way down, except for 2 centimeters, which is intra-abdominal. So in the neck, right? Okay, we're going to have from 1, 2, 3, 4, 5, 6. From 6, right? Okay, it's going to pass through the suprasternal notch at about T2, T3. Right? Okay. So this is not a very good specimen. Okay. Right. Okay. T2, T3. Right. Okay. Right. Okay. And then so that will be as a cervical part. And it runs in the posterior peritoneum, the posterior mediastinum, and it's going to pierce the diaphragm. Okay. Right at T10 to go in the abdomen. So it has a cervical part. It has a cervical part. Yeah. Cervical part, a thoracic part, an abdomen part. I'm going to try and show you all parts. Right, okay? Oh,
I'm sorry, could I demonstration one more time, please?
so 1, 2, 3, 4, 5, 6. 6 it starts, right, okay? At the level of C6, right, okay, which is at the bottom of the cricoid cartilage. Then it's going to run through there it's 25 centimeters long. So there are approximately 4 centimeters in the neck, right? Okay, and there are about 2 centimeters in the peritoneal cavity, right? Okay, so about 19 centimeters. These are just averages, guys. Run through the thorax, okay? Right, and when it runs in thorax, it's going to run through the posterior mediastinum. Right, to the posterior mediastinum. I have an image there to show you. All right, okay? Then it's going to pierce the diaphragm, okay, to enter the stomach. Left of the midline, 2.5 centimeters left of the midline at T11. All right? Okay, so let's see what we can see in the neck. What are some of the relations we're going to see in the neck? So, cricoid cartilage is here, and this is the trachea. So what's anterior to it in the neck is the trachea, right? And also what's anterior to it, right, is the isthmus of the thyroid gland, right? Right, so those are the main things. Posteriorly, it's going to lie right against the prevertebral fascia in the neck. All right, okay? Now, lateral relations. Very important, right, okay? is that the lobes of the thyroid in the neck, this is the right lobe here, this is the left lobe, which is better to see. All right, okay? Left lobe is better to see here. The left lobe, remember that the isthmus of the thyroid gland is anterior to the second, third, and fourth tracheal rings. All right, okay? And so the anterior relation of the trachea with a lateral relation also of the trachea and the esophagus. So you can see it here. Right, okay. Well, two other very important lateral relations you have to know. And that's this one here. And anybody can tell me what's the name of this nerve? What's the name of this nerve? This is the
Is it big?
third big branch of the vagus. Runs right up here behind the thyroid right here. Runs in the tracheoesophageal groove. Okay, let's go for the vagus then. All right, okay. On the right side, right, this is the cartilage sheet. Right? So at this level, what would the arch? What? We're well below the thyroid cartilage. So what artery are we looking at here? Common carotid. Internal, common carotid. Very good. All right. What vein would this be?
Internal jugular.
Internal jugular vein. And what nerve is this?
Vagus nerve.
Vagus nerve. All right. Okay. When it gets to, so everybody remembers the brachiocephalic trunk or not? Off the arch of the aorta here, we have three arteries. This, the brachiocephalic trunk here, is divided into common carotid and this one here, which is coming this way. What is this one? Going to the arm. Subclavian, guys, all right? So at that point now, the vagus is going to give off a branch, right? Very important branch here, right? Which is going to hook around the subclavian and run up in the tracheoesophageal groove, running up here. And that nerve is the
Recurrent laryngeal.
recurrent laryngeal nerve. Recurrent laryngeal, very important nerve, right? Okay, recurrent laryngeal nerve. That again has fibers, right? Motor fibers, which are coming from the nucleus ambiguous, right? Okay, right? Okay, and they are going to supply. You're going to see that part of the muscle of the esophagus is actually striated muscle, and part is smooth muscle. Let me show you all that, right? Okay, so this is the recurrent laryngeal. So recurrent laryngeal is a lateral relation. Let's find the recurrent laryngeal on the left side. We go on the left side now. Here is the left common carotid. And coming down here is the left vagus. All right, okay? All right, I dissect all these things out to show you, right? Okay, left vagus. Now the left vagus, where does the left vagus gives off is recurrent laryngeal. Anybody can tell me? You guys forgot the superior mediastinum? It gives off the left vagus at the arch of the aorta. There's the arch of the aorta. And if we look here now, we see the left vagus coming off, hooks around, you're not seeing here, but hooks around the ligamentum arteriosum, and then runs up now in the groove between the trachea and the esophagus. Right? So what nerve is that? The left recurrent laryngeal nerve. All right? So that's the lateral relation you have to know. Very important lateral relation because it's going to supply, it's going to provide motor innervation for the upper part of the esophagus. Right? Okay? That's a lot of things also. What is this recurrent laryngeal nerve going to do eventually? Everyana. How is it going to get? Where is it going to go? When it's going to pass up behind the, well, just lateral to the thyroid, then it's going to run under this muscle. What muscle I told you this was a while ago? Not in this specific.
Well, I know it runs deep to the inferior constrictor.
Inferior is inferior constrictor here. Inferior constrictor is coming off the oblique line on the thyroid right here. So it's going to run under it, and it's going to supply all of the laryngeal muscles, right? Okay, right? Okay, all of the laryngeal muscles except the cricothyroid, right? The cricothyroid is supplied by the external branch of the superior laryngeal. All right, okay. There's a recurrent laryngeal. So those are the main things you have to know. Another important relation you have to know in the neck is this one, right? This is the common carotid artery. This is the subclavian. This artery coming off of it here, right, is the inferior thyroid artery. Right? That inferior thyroid artery, right, is going to run right here, and here's it going to go in, right, to the thyroid gland. Right? So the inferior thyroid artery is very important because it's the main blood supply to the upper third of the esophagus. Right? That's how you remember things. Right? Okay? Right? So it's the main relation there. Right? No. Right? So that I don't think you need to know much more about the cervical part. Now, one thing you also have to know is this. So this is the esophagus here. There are 4 constrictions in the esophagus. Right? Okay. If I push this down here, I had trouble getting this tube past a constriction here. What do you think that constriction will be? First constriction. You've had a lecture on the esophagus, right? Oh.
That was supposed to be with you, but you didn't finish.
Right. I'm going. No, I know. I couldn't get through the pharynx in the lecture, but I'm going to give that to you on Tuesday morning with the I told you that, right? With the cardio esophageal junction, right? Okay. This can't go too fast with these things. There's so much to tell you, you know. So, right, the first one is the cricopharyngeus. Remember, so the cricopharyngeus belongs to although it's a pharyngeal part of the inferior constrictor, the pharynx, it belongs to the esophagus also. It's part of the upper esophageal sphincter. So it provides right? Anybody can tell me what if I'm going to pass a scope in the esophagus, at what level I'm going to encounter that?
C6.
At C6, but where? When it passes the scope, it has centimeters on the side, 40 centimeters to get into the stomach. But the esophagus is only 25 centimeters long. So what's the first 15 centimeters?
Sir, do you go through the mouth or the nose?
Oh, through the mouth. Okay. The big scope, you know, they can't push it through the nose. So it's from the incisors, right, okay, to the cricopharyngeus, and the cricopharyngeus is right here, right, okay? This is the cricoid cartilage here, right, you understand me? So the cricopharyngeus is right there, right, okay? So that's 15 centimeters from the lips, really, from the incisors, from the incisive teeth, right to here, it's 15 centimeters. The question I often ask is, which is the first constriction you're going to encounter when you pass in an esophagus scope, right, okay? And that's 15 centimeters from the incisors, all right? So you with me now on your system, and you're looking at the side view, and because there's a side view in our monitor. So when I'm passing the scope, I don't do that any longer. I used to do it in my younger days. And the gastroenterologists have taken it over from me. The physicians now, you know, they like to get in on all these things. So they do most of the scopes now. We don't mind. Surgeons don't mind. I'm a retired surgeon, right? By the way, I don't operate much again, but I'm nice to do a lot of this sort of stuff, right? Okay. So first constriction is here. Where do you think you'll encounter the second constriction? Well, we haven't done it as yet, eh? So just going to show it to you. Anybody can tell me what artery is this? Has 3 big branches coming off it. Brachiocephalic, left common carotid, and left subclavian. What is it?
Arch of the aorta.
Aorta.
Arch of the aorta. Remember the aorta has an ascending aorta, the arch of the aorta. When the scope gets to here now, you start seeing this thing, you just start seeing pulsations like that all the time from inside the lumen. And the lumen kind of constricted a little bit. And it's constricted, it pushes it in a little. And you can see the pulsations. Right, okay? That's the second constriction you see. The third constriction now is when it passes the esophagus here. It's not going to pass in the midline. I'm going to take that. I have to do that with you. Right, okay? Just to show the four constrictions first. Right? In the pass behind this, anybody can tell me what that is? This is the hilum of the left lung right here.
Left bronchus.
This is the left main stem bronchus. So it's going to, one, the cricopharyngeus, two, the arch of the aorta, and three, the left main stem bronchus. Then, all right, okay, the next constriction, you're not going to see it on this. I'll have to show you a piece of diaphragm to show it to you. It's hard to really show these things you see, it's hard to bring out a whole cadaver to show you. So I have to show you little things, right? Okay, but it has another important relationship below it. So this is a posterior because this will be anterolateral. So it's an anterior relationship. The aorta. Then the left main stem bronchus is another anterior relation. Right? Okay. All right. Okay. And then what is the structure here? Everybody knows that. This is the fibrous pericardium. We've opened it, and that's the heart. All right, okay? So if I put my hand behind the heart and I go right up in here, what pericardial sinus am I in there?
Oblique.
Oblique. What's anterior in the oblique? In the oblique pericardial sinus. What am I looking at there? What part of the heart? The left pulmonary vein and the right pulmonary vein here. What's that?
Left atrium.
Left atrium, right? So the next relation is the heart, which is C. So how you remember the anterior relations in the thorax? Aorta, bronchus, heart. C for heart, cardiac. Okay, so ABC, right? Simple as ABC, right? Okay, the aorta, left main stem bronchus, the heart. Right? Okay. Now this doesn't constrict it. Right? But sometimes, if you have mitral valve disease, this chamber, the left atrium here, gets very, very dilated. And it pushes on the esophagus, it runs right behind it. Right? Okay? So you won't get obstruction, but you get dysphagia. The person starts complaining of difficulty swallowing. Right? Okay? Right? But we don't put that as one of the constrictions because that's normal. It's really dilated. So the first constriction, now the books will give you figures. 15 centimeters from the incisors. This, some say 22, some say 23, but remember that these are averages. I never ask centimeters. I ask which is the second constriction you'll encounter on esophagus. It's the third constriction, but the fourth constriction now. All right. I couldn't find a big specimen. I couldn't bring a big specimen here, so I have to show you a little specimen. All right, okay? So this is the, all right? Nobody has seen the livers yet. That's later in the semester, right? Okay, so it's the anterior surface of the liver. Anybody can tell me what do you think we see in here?
Gallbladder.
Stones in it. The gallbladder, right? The gallbladder. This is the part of the diaphragm, right? Okay? Part of the diaphragm here, part of the diaphragm here. Now coming through the diaphragm on this side, right? Oh, I thought I tied it so it doesn't come out. I went through these things yesterday. So this is the esophagus up in the chest, right? Okay, and this is just coming out here, coming down here now, and this now, as you can see, is widening. So this is the fundus of the stomach, right? Okay. So this is fundus. Well, not fundus. This is the cardia of the stomach. The cardia of the stomach, right? Okay. Right. Okay. So this is the cardio-esophageal junction, right down here. The esophagus spends about 2 centimeters in the peritoneal cavity before it joins the stomach. right? And I'll be telling you all about that on Tuesday morning. And I'm going to go over the whole of the esophagus again with you on Tuesday morning, right? So the fourth constriction it encounters is as it goes through the diaphragm. Because I'm going to show you that the cardioesophageal junction or the lower esophageal sphincter is not really an anatomical sphincter. It's more a physiological sphincter, right? Okay? So you don't encounter any significant resistance to the scope there, but you encounter significant resistance when it's going through the diaphragm. So that's not at 40 centimeters, now that's 2 centimeters higher than that. So that's at 38 centimeters. So 15, 23, the other one is 27, and then this one is not 50, sorry, not 50. 15, 23, 27, and 38. This is 38 centimeters. All right, so now I want to show you important relationships in the so here the left lung, the right lung, left lung. This is the pericardial sac with the heart in it. Right here we have the main branches. This is the trachea here. That's the esophagus back here. Right, okay. Okay. So it's up here. So this is the arch of the aorta going back here, coming right here. Okay, let me do it from this way. Posterior. This is where I really want to show you. This is the esophagus here. Right? So in the posterior mediastinum, well, this is superior mediastinum, where the arches, and up here the superior mediastinum. All right, okay? So the 3 main branches of the aortic arch is this one, which is the brachiocephalic trunk, which is divided into the subclavian and the common carotid. It's the trachea, the esophagus. Right? Then this is the left common carotid and the left subclavian. Then the descending aorta now. Descending aorta is right at the end of the arch, which is here. But it's hard to get a specimen with the esophagus and the ascending aorta, and the descending aorta or thoracic aorta. So thoracic aorta starts right here. All right, guys? That's at the end of the arch. All right, okay? And it's going to run down in the posterior mediastinum with the esophagus. So those are the 2 main structures in the posterior mediastinum. So you have to know this relation. It's going to run right here. Right? But look what's going to happen. This throughout the posterior mediastinum, right? It's going to be lying, the esophagus is going to be lying more in the midline, and this is going to be lying more to the left. As we get to the end now, this esophagus is going to start moving anteriorly and to the left, right? Again, sorry, anteriorly and to the left, and this is going to be going more into the midline now, right? Okay, this and the aorta. I'll show you all this, some images of these. All right, so let me see if I can just pull up some and show you some images because. What time we can say it? 12:30 good? Yeah, that's fine. Okay, so let's look at some images now. All right, okay, so here I've put the arterial blood supply, the relation of the esophagus. This is the area we're going to do on Tuesday. The cardioesophageal junction and these 2 centimeters of the esophagus. But because I hadn't completed the esophagus with you in my lecture, I'm going to start from here first because this alone doesn't take me a full hour. All right, okay, so I can do both together. Almost every year, I have to end up finishing the esophagus with that lecture. So, all right, so the esophagus, as we see here, right, it's going to, this first constriction is going to be above this level here, all right, at the cricopharyngeal muscle. Then it's going to pass, this is the inferior thyroid artery seen coming up here, right, coming off, it's going to go to the thyroid, okay? Then it's going to be passing, right, okay? The esophagus is going to pass first of all, right, okay? It's going to be related to the arch of the aorta, It's going to cause a constriction. And then this shows you it's a little bit more left than that here, right? It's going to pass behind the left mainstem bronchus, right? Then it's going to pierce the diaphragm, right? Okay, right? At T10, 2.5 centimeters left to the midline, and that's where you get the full constriction. And it's going to go into the stomach at this point. Now, blood supply. We divide the esophagus into thirds. I want to say one thing before, one other thing I want to show you before. I told you about the constrictions. There are four constrictions, and then there are curvatures. So the esophagus in the neck is in the midline. As it approaches the thoracic inlet, that's that same part of the thorax I showed you, it sort of goes to the left of the midline. Then as it gets to the sternal angle, and everybody knows the sternal angle, what's the name of that plane that runs through there? The sternal angle. Everyone? Forgot your chest already? Transverse thoracic plane, is that everyone?
What did you say, sir? You were breaking up a bit for me.
The plane that goes through the sternal angle. Is that the transverse thoracic plane?
Yes, at the angle of Louis.
Angle of Louis, yeah. Okay. All right. It gets into the midline and stays in the midline. All right, okay, until about T8. Then it starts going to the left and anteriorly. All right. And then it's going to pass behind the seventh, right, costal cartilage. There's 7 costal cartilage here. All right. At the level of T11, 2.5 centimeters left to the midline. So those, you have to know those curvatures too. All right, okay? All right. So, coming back now. We sort of divide the esophagus into thirds. All right, okay? Upper third, middle third, broadly speaking, a lower third. We don't have no levels for those. You have a cervical part, you have a thoracic part, and you have a abdominal part. All right, okay? Now, the blood supply of the upper third comes mainly from the inferior thyroid artery. And you saw the inferior thyroid artery, right? I showed it to you running up in the neck. So it supplies the upper third. They say middle third, but it's a bit more than middle third. Most of the body of the esophagus here gets its main blood supply from some segmental branches of the descending aorta, right, or thoracic aorta. So you can see them here, 1, 2, 3. Right? It also gets some blood supply from the left bronchial artery, right, okay, and, right, mainly, right, those are the, so mainly from the esophageal branches. The lower third now gets its blood supply from in the stomach, from the left gastric artery. So these are the esophageal branches of the left gastric artery coming up here. So you have to know those because they're going to put the pin up here. They're going to ask you which of these arteries supply. They're going to put the pin here, ask you which, right? You understand me? So you have to know that upper third is mainly, right? Inferior thyroid artery. Middle third is more the descending aorta, right? Okay. And then down here, these esophageal branches of the left gastric goes back up into the is what we call esophageal hiatus of the diaphragm and supply it up, all the way up to here. The venous drainage, upper third tends to go some through but they drain mainly into the brachiocephalic trunks, right? Okay, so that's the answer they're going to ask you for. The middle third here, they drain more into these veins. Anybody know the names of these big veins? I just say, I don't put any labels on my things, because I want you to know what they are. Do you know what these two veins are? Anybody can tell me which is this one? What's the name of this vein?
Esophagus?
The Esophagus vein. Let me show it to you. I have everything here. Just let me show you. But just have, I don't have the time. I don't have 2 hours. No. not enough. All right, so here we have the left brachiocephalic vein. All right, this is the right internal jugular vein. This is the right brachiocephalic vein here. Right? No, that's the left brachiocephalic. This is this part here, is the right brachiocephalic, and they meet right here, and they form the IVC. Sorry, it's not IVC, the superior vena cava. Superior vena cava, right here. If you go inside here, we're actually right in here, and that's the superior vena cava you see in here. Right, okay? It's so easy to see it. But coming from this vein here, right, that we see coming up here, we have this big vein coming forward over the right hilum. So this is the lung, the right hilum of the lung here. So this is the pulmonary artery. This is the sorry, I'm gonna get it right again. This is the bronchus here, and it's the pulmonary artery, and these are pulmonary veins, one here and one here. Right, okay? So here, this is the arch of the esophagus. Right? So how big it is. Right? It joins the superior vena cava and then drains to the right atrium. Right, okay? So the arch there. Esophagus. All right. So this is a very important part here now. The lower 1/3, they're going to drain to the left gastric vein. All right, the left gastric vein with the green arrow is here. All right, okay? And it's very important because sometimes anybody can tell me what organ we're seeing right here under the right diaphragm. What is this? Big organ cutting through there. Liver. So what's this big vein that's going to it? Hepatic portal vein. I know you haven't done it as yet, huh? Okay? Now, blood from this part of the esophagus is draining down here and going into the left gastric vein and then draining into portal vein. So what happens if somebody drink a lot of rum and they get significant cirrhosis of the liver? What do you think will happen in this vein? You ever heard of something that can happen there? The pressure in this system, there are two systems in the body. There's a systemic system of veins and a portal system of veins. Right? So if you were to have cirrhosis of the liver, then you get portal hypertension. Now, right at this point here, this is one of the best examples of portal systemic anastomosis. Anastomosis between the systemic system and the portal system, right here. Right? And when you get portal hypertension reflected into this, you get this condition. So the lower end of the esophagus, there's the stomach. Right? These are zygous veins. Right? And these are going to drain into the left gastric vein. So when the pressure here is, then these anastomoses between them open up. Right? And because they're pretty small, you're going to get dilatations. These are called esophageal varices. When somebody coming with bleeding esophageal varices, you can collect the blood in a bucket almost. Literally, they're almost exsanguinated. Sometimes you have to get a balloon down there and blow it up quickly just to stop the bleeding until you can do something for them. Right, okay? So, very important point. A lot of questions come in this area. All right, okay? We're going over all this again on Tuesday morning. Just want to show you one more thing, and then I'm going to let Mr. Miguel go to lunch. Right? I am hungry too. So just to show you basically the relations we'll go over the relations of the abdominal part of the esophagus on Tuesday. But in the thorax, right, okay, on the right side, right, the only significant lateral relation of the esophagus, there's the trachea here, the esophagus here, right, is the it's the azygos and the arch of the azygos. So when somebody comes with a cancer of the esophagus, you don't want to go, well, let me show you on the left side. On the left side, you have the arch of the aorta. You have these common carotid artery, subclavian artery, and esophagus there, right? Okay. Then you have the descending, the thoracic aorta here. So you're not seeing, this is all of the esophagus is seen on the left side. So if you're going to resect the esophagus for cancer, which side of the chest do you think you want to go into? This side or that side? We're going to open the chest to take out the esophagus. Then I have to mobilize the stomach and bring it up in there to make an anastomosis. Eh? So you would agree that it's easier to go in on the right side. Eh? The only thing you have to divide on the right side is the arch of the azygos. And that can be divided, tied off, and no other problems. So this is the side you're going. All right. I have one last thing to do, and then I'm going to take some questions for a few minutes, and then okay, here we go. The innovation. Now, I don't want you to say I didn't show you these things. Eh? So this is the left. This is the left vagus here. All right. Oh, sorry. Wrong place, see? Left vagus here. Right? Right? There's a recurrent going up here. Right? Recurrent, the recurrent nerve going here. The vagus now is going to now pass behind the hilum of the lung, and it's going to go on the side of wall of the esophagus, and it's going to break up into a plexus called the esophageal plexus. Right? The right vagus now, here it is. It gives off its recurrent laryngeal nerve, which we showed you up here, this one, right? And then that is going to go on the behind the right hilum of the lung, and it's going to go onto the esophagus, and it's going to break up again and form a plexus. So up here now, it's related to the recurrent laryngeal nerve, and down here now, is going to be more related to the well, what's going to happen is the rest of the vagus. All right. Now, after I finish this part, I'm finished. Okay. So they're not showing you the recurrent laryngeal nerve in this image. That'll be going up here. All right. But this is the esophageal plexus of the vagus. This is going to supply the lower esophagus. Now they're going to reform again. This is the right vagus. This is we're at the back. So this is the right and this is left. Right vagus and left vagus. Right, okay? They're going to reform into the not really right and left vagus. By the time they get down here now, the stomach has undergone this rotation, and they're going to have the anterior and posterior vagus. So I want to say something about the wall of the muscular wall of the esophagus. In the upper third, the muscle in the muscularis of that's the longitudinal and circular muscles, they are striated muscle. Very important. The middle third is a mixture of striated and smooth muscle. And the lower third, they are just smooth muscle only. So we know the recurrent laryngeal nerve comes from the nucleus ambiguous, which is only really one muscle fibers, or they only want nerves to supply striated muscle, basically, right? It's not as simple as that, okay? So the innervation of the upper esophagus is mainly recurrent laryngeal nerve, and the innervation of these muscles down here, the smooth muscle, is the vagus. All right, okay? We'll do the lymphatic supply when we do on Tuesday. So any questions now, right? Okay? I think I've shown you more than enough today.